Hello everyone. Today we will talking about breast and nipple condition objectives. After completing this session, participants will be able to recognize and describe how to manage these common breast and nipple conditions. Number 1, flat or inverted nipples. Number 2, engorgement. Number 3, mastitis. Number 4, sore or cracked nipples. Also, participant will identify when to refer to advanced medical staff for further treatment. As healthcare workers, we must recognize breast conditions and help mothers, parents, caregivers manage them. If a mother does not find healing and relief, breastfeeding could stop. Therefore, with right knowledge and practice, you can help the treatment plan move forward. Which is the best breast for feeding? Breasts and nipples come in different sizes and shapes. When a woman shows concern about the size of her breast, what counseling should you provide? Breast size differences are due to amount of fat and not the amount of tissue that produces milk. A woman may need reassurance that she can produce enough milk, regardless of the size of her breasts. Nipples and areolas are different shapes and sizes too. Nipples can change shape during pregnancy and become more protractile or stretchy. During pregnancy, there is no need to diagnose or treat a nipple that looks flat or inverted. As with breast size, babies can breastfeed from almost any shape of nipple. It is important to reassure women that they can breastfeed whatever the size or shape of their nipples. Sometimes the size or shape of a nipple makes it more difficult for a baby to attach to the breast. The mother may need extra postnatal support to make sure her baby can suckle effectively. What they observed about the nipple in picture number 1. The nipple looks flat. A baby does not suck from the nipple. They take the nipple and the breast tissue underlying the areola into their mouth to form a teeth. In picture number 2, the mother is testing her breast for protractility. She is finding out how easy it is to stretch out the tissues underlying the nipple. The nipple is quiet, protractile, and it should be easy for her baby to stretch it to form a teeth in their mouth. The baby should be able to suckle from the breast with no difficulty. Nipple protractility is more important than the shape of a nipple. What do you observe about this nipple? The nipple is inverted. If this woman tests her breast for protractility, her nipple will go in instead of coming out. Inverted nipples do not always present a problem. Remember, babies attach to the breast, not to the nipple. If you think her nipples may be inverted, the best way to help is to build her confidence and provide good support from birth. Clinical management for flat and inverted nipples. Antenatal treatment is usually not helpful and can have risks. Most nipples improve around the time of delivery without any treatment. Help is most important soon after delivery when the baby starts breastfeeding. It is important to build the mother's confidence. Explain the beginning may be difficult, but she can succeed with patience and persistence. Explain that a baby suckles from the breast, not from the nipple. Her baby needs to take a large mouthful of breast. Explain that as her baby breastfeeds, the baby will stretch her breast and nipple out with suction. Encourage skin-to-skin contact and allow her baby to explore her breast. Let the baby try to self-attach to the breast whenever they are interested. Some babies learn best by themselves. Show her how to lean back in the reclining position to give the baby skin-to-skin contact. Some babies can attach more easily in this position. Help her to position her baby for a better attachment. If a baby does not self-attach well, help the mother position the baby for better attachment. Give this help early on in the first day or two before her breast milk comes in and her breasts are full. Try different position to help with attachment. Help her to stimulate her nipple before a feed. If she massage her nipple until it hardens, then a baby usually attach better. There are products to help this, example, breast pump or syringe, but often her hand is sufficient. Shaping the breast, this can make it easier for a baby to attach to shape the breast. Cup feeding, if a baby cannot suck it effectively in the first week, help the mother to express her milk and feed it to her baby cup. Expressing milk also helps to keep the breast soft so the baby attaches more easily. Expressing milk also helps to keep her milk supply sufficient. She should not use a bottle because that can make it more difficult for her baby to attach. And this method is for treating inverted nipples postnatal and help a baby to attach to the breast, and it's not certain whether it is helpful antenatally. Teach her to put the smooth end of the syringe over her nipple. Gently pull the plunger to maintain steady but gentle pressure. Do this for 30 seconds to 1 minute several times a day. Push the plunger back to decrease the suction if she feels pain. This prevents damaging the skin of the nipple and areola. Push the plunger back to reduce suction when she removes the syringe from her breast. Use the syringe to make her nipples stand out just before she puts her baby to the breast. Differences. Differences full versus engorgement breast. Sa full, hot siya, heavy, hard, milk flowing, and no fiber. Sa engorged breast naman, painful, edematous, tight especially nipple, shiny, may look red, milk not flowing, may be fever for 24 hours. What do you observe in this photo? Number 1 is full lang siya. So, number 2 naman, engorged breast. Engorgement causes plenty of milk, prevention, frequent removal of milk, early initiation, delayed start to breastfeed, prevention, start breastfeeding soon after delivery. Causes of poor attachment to breast, prevention, ensure good attachment, infrequent removal of milk, prevention naman, encourage unrestricted breastfeeding, restriction of length of feeds, encourage unrestricted breastfeeding. Treatment for breast engorgement. Do not rest the breast. If the baby is able to suckle, the treatment is hold baby skin to skin, help with attachment, and allow to suckle frequently. This stimulation oxytocin. If baby is unable to suckle, express milk by hand or with a pump. Before feed to stimulate oxytocin reflex, the treatment is warm compress or warm shower, massage to neck and back, light massage of breast, stimulate nipple skin, help mother to relax. After feed to reduce edema, cold compress naman. What do you observe in this photo? Mastitis, tama? Mastitis can be confused with engorgement. However, engorgement affects the whole breast and often both breasts. Mastitis affects a part of the breast and usually only one breast. A woman with mastitis has severe pain, fever, and feels ill. Part of the breast is swollen and hard with redness of the overlying skin. Symptoms of black duck and mastitis. Black duck occurs when the milk is not removed from a part of a breast. Mastitis may develop in an engorgement breast. Another cause may be called black duck. Milk stasis, when milk stays off a breast because of a black duck or engorgement. Non-infective mastitis, if this is not removed, it can cause inflammation of the breast tissue called non-infective mastitis. Infective mastitis when a breast becomes infected with bacteria. Symptoms include in black duck, a tender lump, redness of the skin over lump. Often the woman has no fever and feels well. Mastitis symptoms, severe pain, fever, feels ill, the breast is swollen and hard with redness of the overlying skin. Causes of black ducks and mastitis. Symptoms, infrequent or short breastfeed. Causes: mother is very busy, baby sleeping throughout the night, change routine, mother stress, inefficient removal of milk from part or all the breast. The causes: ineffective suckling, pressures from clothes, pressure from fingers during feeds, large breast draining poorly. Damaged breast tissue, the causes is trauma to breast. Bacteria gaining entry, causes is nipple fissure. Treatment for black ducks and mastitis. Improve milk removal. Look for a cause and correct. Poor attachment. Pressure from clothes. Large breast draining poorly. And advise the patient frequent breastfeed, gentle massage towards nipple, warm compress, and analgesic like ibuprofen. Suggests, if helpful, berry position. Treatment for black ducks and mastitis. If any of these symptoms continue, symptoms severe like high fever, large area affected, fissure, no improvement in 24 hours, advanced treatment required, complete rest, refer to an appropriate medical provider for antibiotic treatment. What do you observe in this picture? It's sore and cracked nipple. The most common cause of sore nipples is poor attachment. If a baby is poorly attached, the nipple pulls in and out as they suck. The skin of the breast rub against their mouth, which is very painful for the mother. At first, there is no crack, and the nipple may look normal. Sometimes, it may look squashed with a line across the tip of the nipple when the baby releases the breast. If the baby continues to suckle in this way, it damages the nipple skin and causes a fissure across the tip of the nipple. There may also be fissure around the base of the nipple. Exception: when nipples are cracked or damaged, washing them with soap and water may help to stop infection. Refer the mother to a healthcare provider if she needs more help. What do you observe in this picture? Sore nipple. If a woman has sore nipple or a fissure, please suggest after breastfeeding, she rubs express milk over the nipple and areola with her finger. This promotes healing. Not to wash her breast more than once a day, not to use soap or rub hard with a towel. Washing removes natural oils from the skin and makes soreness more likely. Not to use medicated lotion and ointment because this can irritate the skin and there is no evidence that they are helpful. Help her to improve her baby's position so that the baby is well attached. The baby continue breastfeeding and the nipples will heal rapidly when they are not being damaged. What do you observe in this picture? Meron siyang candida infection. The second most common cause of sore nipple is infection with candida albicans, also known as thrush. Candida infection can make the skin sore and itchy. Such infection often follow the use of antibiotic for infections such as mastitis. Some mothers describe a burning or stinging that continues after a feed. It may be worse between feeds than during them. This is different from soreness due to poor attachment, which is mostly during feed. Sometimes the pain shoots deep into the breast. A mother may say it feels as though needles are being driven into her breast. How have you heard mothers describe this? Suspect candida if sore nipple persists even when the baby's attachment is good. Check the baby for candida. They may have white patches inside their cheeks or on their tongue, or they may have a red rash on their bottom. Refer both mother and baby to an appropriate healthcare provider for treatment with nystatin. Suggest that the mother stop using pacifiers and nipple shield and help her to stop. If these are used, they should be boiled for 20 minutes daily and replaced weekly. In women who are HIV infected, it is particularly important to treat breast thrush and oral thrush in the infant promptly. What do you observe in this picture? Tongue tie, right? The tongue tie can also be a cause of sore nipples. Many babies with tongue tie can breastfeed without any difficulty. However, sometimes a baby cannot get their tongue far enough over their lower gum to reach the large ducts beneath the areola. This causes the baby to have difficulty attaching and suckling effectively. The baby may not get enough breast milk from each feed. Mothers may complain of sore nipples because of the friction caused by shallow attachment. Even though the baby's attachment may improve, they may have difficulty suckling effectively. If a baby has difficulty with breastfeeding due to a short frenulum, tongue tie, try to help the baby to take more of the breast into their mouth. In some cases, this is all that is necessary. However, if the tongue is severe or if the difficulties continue, may need to refer the baby to a specialist. Clinical management for sore nipples. Look for a cause, check attachment, examine breast engorgement, fissure, candida. Check the baby for candida or tongue tie. Give appropriate treatment, build mother's confidence, improve attachment and continue breastfeeding, reduce engorgement, suggest for frequent feeds and expression, applies Apply moist wound healing if fissure is open or ulcerated. Treat for candida if symptoms present or if the mother has pain between feeds. This is the end of our slide. Thank you for listening.